So here's something that's maybe a bit surprising. Despite all the incredible medical tech we have, doctor and nurse burnout, it's sky high.
It really is. And a big part of it, it seems, is this feeling of, well, not being able to really connect with patients to provide that core element of care.
Exactly. It makes you think of that quote, from Francis Peabody way back in 1927.
Oh, yeah. Which one?
The secret of the care of the patient is caring for the patient. Sounds simple, right? Almost obvious.
It does sound obvious, but somehow modern healthcare, with all its pressures and admin,
Yeah.
it kind of buries that essential point sometimes.
Totally. And that's what we're diving into today. Because when you hear AI in healthcare, your first thought might be, robots, less human interaction, maybe something colder.
Right, that's the common fear, isn't it? Dehumanization.
But what if? What if AI actually offers a way to bring back more of that human touch, to restore it?
And the fascinating idea, and maybe a bit counterintuitive for you listening, how can machines make medicine more human? You might be skeptical, and honestly, that's fair.
It is. So we've really dug into this, looking at various sources, especially Eric Topol's book, Deep Medicine.
Right, how artificial intelligence can make healthcare human again. Really provocative title.
It is. Our mission here is to unpack how AI could maybe support the human stuff, the care, the empathy, the connection, instead of just replacing things.
So let's get into it. How could AI actually help doctors and nurses deliver, well, better care?
Okay, so the big one, maybe the most immediate one, is time. We all feel it when we go to the doctor, right? That rushed feeling.
Definitely. There was that survey at the University of Alabama at Birmingham. Patients use the word rushed a lot to describe their doctor.
It really paints a picture. And Russell Phillips over at Harvard had that great line about electronic health records.
Oh, the EHRs.
Yeah, he basically said they've turned doctors into data entry technicians, which, takes away from patient time.
Massively. All that clicking and typing. It's essential, sure, but it eats up minutes that could be spent talking, listening, connecting.
But this is where AI could potentially step in, right? Automating some of that data entry, maybe even generating visit notes.
Exactly. There are already pilots happening. Stanford's looking at digital scribes, and lots of companies are working on this tech. The idea is to lift that administrative burden.
And the impact of just having a little more time, it's actually quantifiable, isn't it?
It is. That National Bureau of Economic Research study is pretty striking. For home health visits, every extra minute spent with the patient reduced the risk of readmission by 8%.
8%, just from one extra minute.
Yeah, it really shows how valuable that time is. It reminds me of William Osler over a century ago saying you need at least half an hour with a patient for a proper exam.
Right, so AI could potentially give back that gift of time.
That's the hope. More time for the actual caring.
Okay, so time is huge. What about diagnostics? That seems like another area where AI could really make a difference.
Absolutely. Diagnostics is complex. We humans, even doctors, we rely on mental shortcuts, heuristics.
Like the representativeness heuristic, judging based on past similar cases.
Precisely. And Donald Rettelmeyer's work showed how those shortcuts, while often useful, can sometimes lead us down the wrong path diagnostically.
It's not about doctors being bad, it's just how brains work under pressure, right? That fast medicine idea Topol talks about. System 1 thinking.
Exactly. Quick, intuitive. And while you'd think just telling doctors to slow down, use more analytical system 2 thinking would fix it, studies haven't really borne that out consistently. It's more complex.
So AI could come in as what? Like an incredibly knowledgeable assistant that doesn't have those same cognitive biases?
Sort of, yeah. It can process absolutely vast amounts of data. Think about Merge Healthcare having access to 30 billion medical images.
Wow, okay.
And AI can sift through that, looking for patterns or subtle signs humans might just miss. There was that example of AI predicting post-surgery complications using data from experienced physical therapists.
That's incredible. And didn't AI help with super fast genomic sequencing for sick newborns?
Yes, there have been cases like that where it rapidly helped pinpoint rare genetic conditions. Life-saving stuff.
But it's not perfect, right? There's this idea of shallow medicine, too.
Right. That's the flip side. If the AI is trained on incomplete or biased data, its conclusions can be flawed. Or if the underlying evidence itself is weak, like some argued with the American Heart Association's blood pressure guideline changes. Garbage in, garbage out, basically.
Makes sense. So moving beyond diagnostics, what about treatment, making it more personal?
Yeah, personalized medicine is a huge area of promise for AI, like predicting how your specific blood sugar will react to certain foods based on your gut microbiome.
Oh, right. The Weizmann Institute and Stanford studies and that company day too.
Exactly. Moving beyond generic advice to truly individual recommendations.
Which feels necessary when you look at how, well, hit or miss some drugs are for the general population.
Totally. Topol points out that for some blockbuster drugs, like, say, Abilify for depression, maybe only 1 in 5 patients gets a real benefit.
Wow, 1 in 5.
Yeah. So we desperately need better ways to predict who will respond to what. That's where companies like Tempus Labs come in, especially in cancer. They're building massive databases to try and match patients to treatments based on others with similar profiles, creating a kind of digital twin.
Okay, let's zoom in a bit. Specific fields. Radiology seems like a natural fit for AI with all the image analysis.
It really is. AI's gotten remarkably good at reading scans. There was a study classifying chest x-rays with like 95% accuracy. Companies like Zebra Medical Vision are doing this at scale, fast, and cheap.
But that's where the AI will replace radiologists' fear comes in, isn't it?
It does come up a lot. But I think the more likely scenario, or at least the more hopeful one, is that AI handles the more routine scans, freeing up radiologists for the complex cases, the ambiguous ones, and reducing errors from fatigue, maybe.
Plus, a human radiologist sees the whole picture, right? Not just what the algorithm was trained on.
Exactly. They bring context, clinical correlation, find incidental things. It's a different kind of assessment.
What about pathology? Analyzing tissue samples.
Also, very promising results there. AI showing potential in predicting lung cancer survival from slides or detecting tiny metastases, like Google's work showed. Though some studies have had issues with false positives, so it's still evolving.
And ophthalmology. Eyesight.
Huge strides there. Detecting diabetic retinopathy, a big cause of blindness. AI models from Google, IBM. Even a teenager developed one. And DeepMind is working on macular degeneration. Really promising for catching things early.
Okay, and cardiology, heart health.
AI's been used in ECG interpretation for a while, though early versions were limited. Now it's getting better, and there's potential in analyzing echocardiograms, MRIs, predicting heart disease risk from EHR data, too.
Right, like the AliveCor Cardia band for detecting AFib. That beat Apple to market, didn't it?
It did, yeah. Shows the pace of innovation.
So AI is making inroads in all these physical health areas, but what about mental health? That feels so inherently human.
It does, but the research here is actually quite surprising in some ways. You know the virtual human, Ellie.
Vaguely, yeah. An avatar.
Right. Studies found people sometimes disclosed more sensitive information to Ellie than to a human therapist.
Really? Why would that be?
The thinking is maybe people feel less judged by the avatar, which is fascinating and could open up avenues for support, especially given the shortage of mental health professionals.
And could AI also help maybe detect issues earlier through analyzing voice patterns or social media, digital phenotyping?
That's the idea. USC used voice analysis to predict marital problems. Others are looking at voice markers for PTSD, depression. It's early days, and predicting treatment response is still really tough in mental health, but it's an active area.
Okay, now for the really sci-fi sounding stuff. Virtual medical assistants, like an AI health coach in our pocket.
It's moving in that direction, yeah. The concept is an AI that integrates your personal health data from wearables, sensors, whatever, with medical knowledge to give you personalized coaching. Think voice interfaces, like a super smart health Siri.
We already have bits of that, like the AliveCor app or Migraine Alert.
Exactly. Those are narrow examples. The vision is something much more integrated.
But the data, who owns it? Who controls it? That seems like a massive issue.
Absolutely critical. If we're feeding all this personal health data into an AI, we need to ensure individuals own and control it. Otherwise, the potential for misuse by insurers, employers, it's huge. Decentralized, secure storage is key.
Could you give us an example? Paint a picture of how this might actually work for someone.
Sure. Imagine Bob, his virtual assistant Rachel, notices subtle upward trends in his resting heart rate and blood pressure overnight.
Okay.
Rachel might prompt him. Bob, trends look a bit off. Let's do a quick retina scan with your phone. Based on that scan, combined with his known genomic risk for, say, cardiovascular issues, Rachel flags a potential concern and offers to schedule a telehealth check-in with his doctor.
Proactive. Okay. What else?
Or David. He tells his assistant about nagging stomach pain. The AI analyzes his description, checks his family history, maybe flags a genomic marker for gallbladder issues, and suggests, "This sounds like it could be gallstones, David. Let's find a good gastroenterologist nearby."
It's like a personalized medical detective.
Kind of. Or think of Randy. gets his gut microbiome results back. His coach, Robin, sees an imbalance, explains it simply, and maybe even auto-orders a personalized probiotic or dietary kit to help fix it.
Wow, that's specific.
And maybe Sarah, with asthma, her assistant Katie, sees high pollen counts forecasts for her area, knows her triggers, reminds her to take her preventative inhaler, maybe suggests an indoor workout instead of her usual run, and asks her to do a quick peak flow reading via a connected device.
Taking preventative action.
One more, John. His assistant Anne detects dropping oxygen levels and a spike in blood pressure during his sleep via his wearable.
Sleep apnea.
Potentially. Anne gently flags it. John, seeing some patterns here consistent with sleep apnea, especially with those lifestyle changes you mentioned, might be worth discussing with Dr. Evans.
Yeah.
And help schedule the appointment.
These examples really show the potential. But even with all this, you and Tupel both stress that the human element remains vital, irreplaceable even.
Absolutely. AI can be amazing at processing data, finding patterns, recalling information, but it cannot replicate human empathy, presence, that connection. Abraham Verghese writes so powerfully about this.
Yeah. And it's worrying that empathy can sometimes decline during medical training, isn't it?
It is. The sister itself, the pressure, the workload, can unfortunately grind it down. But the good news is empathy isn't fixed.
It can be learned.
Yeah.
Cultivated.
Yes. Our brains are plastic. We can train these skills. Think about Julia Schoen learning the importance of really listening, learning from, and loving her patients. Or Sarah Parker's story of that profound nonverbal connection with a dying patient. That's not something an algorithm does.
Mm-hmm. And the physical exam. Does it still matter when we have MRI and CT scans?
Verghese argues passionately that it does. It's not just about gathering data. It's a ritual. It builds trust. It's communication through touch, far more than just ticking a box that says WNL within normal limits.
Right. Not just going through the motions, like Dr. Kanu Chatterjee, really using the exam to understand the patient.
Exactly. There's real diagnostic value there, too, still.
And some things just have to remain human. Delivering bad news, for instance.
Unequivocally. That requires immense sensitivity, empathy, understanding the patient's perspective. There are frameworks like the Spikes protocol to guide clinicians, but ultimately, it's a deeply human task. AI has no place there.
So if AI takes over more of the knowledge part, the data crunching, what does that mean for training future doctors?
It suggests a shift in focus, I think. Yes, you need the scientific foundation, but maybe less emphasis on pure memorization and much more on emotional intelligence, communication skills, empathy, the ability to connect. Selecting for those qualities becomes even more important.
Okay, so let's try and wrap this up. What are the big takeaways from this deep dive?
Well, I think the main thing is potential. AI has this huge potential to give clinicians back time, to sharpen diagnoses, to personalize treatments to make things more efficient.
Which, paradoxically, could allow for more human connection, not less.
That's the core idea. It's about augmenting the human, not replacing the human. Seeing AI as a partner to handle the data so the humans can focus on the caring.
A partnership model.
Exactly. A collaboration to enhance those essential human qualities in medicine.
Which leaves us and you listening with a final thought to chew on. If AI gets better and better at the knowing part of medicine, the facts, the analysis, the probabilities,
then maybe the real art of healing, the true value proposition of the human clinician, lies increasingly in the caring part, a uniquely human capacity for empathy, connection, and presence.
So, think about it. What do you value most in that human connection when you seek care? And how could technology, thoughtfully applied, actually help strengthen that rather than diminish it? Something to ponder as we navigate this future.